Hello, and thank you so much for attending today's webinar, Why Partner with Lourie Life Health. My name is Chris Johnson, Senior Vice President and Partner. I would like to take an opportunity to thank each of you for taking time out of your schedules to join us here today. Today's webinar is intended for prospective agents, perhaps wanting to get into this business, prospective agents, maybe looking for a new home, or for existing agents who are just looking for a refresher on the resources that we provide our agent partners. Before we get started, I wanted to introduce to you the GoToWebinar control panel. On the right-hand side of your screen, this is an open forum, so we look forward to and encourage any questions or comments as they may arise. I ask as they do, where you see the arrow next to questions, post them there. We'll take an opportunity throughout to answer any and all questions that you may have. Certainly any further questions, pick up the phone at the conclusion of today's webinar and give us a call, 803-256-2067. And don't worry if you did not have time to write that number down. I'll give you an opportunity at the end to get that number. So with that said, let's get started with today's exciting presentation. For our agenda here today, try to keep these around 30 minutes. I'll talk more about Lourie Life Health, talk about who we are, what we do, and really what separates us from our competition. We'll talk about the opportunity. We'll talk about the opportunity in our markets, the opportunity with us, and really what does set us apart. That's training, marketing, and support. We'll wrap it up with how we can help you, resources that are available to you, and then any next steps and questions that you may have. I've got an opening quote here from myself. It's all about the mission, not the commission. And I think that really speaks to what it means and what it's like to partner with an organization about Lourie Life Health, but it speaks to why you are in this business. And I truly feel that if you do right by your clients, a needs-based approach, a portfolio based approach, you take care of your clients, that everything else will take care of itself. It takes work, it takes resources, and those are all things that you'll hear from us today about what we offer and how we can help you grow in this market. So who is Lourie Life Health? We are among the leading Medicare Health and life agencies in the Southeast. You can see right there where the star is located. Our home office is in the heart of our great state of South Carolina, in Columbia, South Carolina. We do have satellite offices in Greenville and Myrtle Beach as well. But our footprint is the Southeast. And so although we have non-resident licenses, I think in 40 states, this represents the core of those independent agent partners that we're looking to partner with. We were founded in 2011 with the intent of being a different type of agency, where our focus quite simply is on you and providing you with the highest level of service in the industry. Our mission speaks to that. We give agents the training, marketing, and support to develop them as the trusted advisor within their community. Specializing in Medicare Health and Life, we are committed to each partner's professional growth and success. So while Lourie, we're committed to what I consider to be the three pillars of an agent's success. That is training, marketing, and support. And we'll talk about each of these three pillars in depth here today. Well, first off, it's a team approach. We could not do what we do without our people. We have the greatest team in the industry. I've been in this business 18 years, and I can tell you that we've got the best in this business. I would put our team up with anyone else, not only regionally, but throughout the country. We're an agency run by agents. This has become almost cliche these days. My business partner and I, Joel Lourie, started in this business as independent insurance agents, helping people do what you do every day. Many of the people that you will work with on our broker development team are licensed agents who started doing what you do. And I think that that's important because we know what it's like to be in the shoes of an independent agent. You know, we've sat across the kitchen table. We've helped someone uncover their needs. We've helped overcome objections, right? And it's important to know that you're dealing with people who know what it's like to walk in your shoes. Next, commissions are paid direct. You are fully vested day one. We are not in the commission paying business. We're in the training, marketing, and support business. If you're working with an upline where you're having to assign your commissions to them, I would encourage you to look at other options and really, quite honestly, look at an organization, whether it's ours or any others, where you're not having to assign your commissions. Extensive in-person and online training. Next, compliance. Compliance is a two-way street. We do things the right way. We're looking for agent partners that do things the right way. I think that this next bullet point, all the bullet points, is probably the single most important bullet point, and that's individualized marketing plans. So no matter where you are, watching this webinar from today, you have different needs. You could be in rural South Carolina, you could be in metro Atlanta. Two agents, two different markets, two different sets of needs. You could be an agent that's been in the group business, the employer benefits business, and you're just now getting, say, into the individual Medicare and ACA business, or perhaps you're, a final expense agent. You've never offered health products at all. Two different agents, two very different sets of needs, right? You could be coming into this with a large book of business. You could be just starting out. And so what we want to do is we want to meet you where you are, knowing that each of you have different needs, to talk about what works for you and how we can help you. That's going to include free quoting and enrollment software. And then the cherry on top is the first class support during appointments. So we offer the full life and health portfolio. I mentioned my business partner, Joel Lourie. We partnered together 11 years ago. And it took us some time to figure out what we wanted to be when we grew up. Some of this was some challenges, some of this was some mistakes, but we really narrowed and honed in on the individual Medicare and ACA side, and then rounding out with a portfolio of products. So we're going to start at the top: final expense whole life, term life, traditionally fully underwritten life products as well. On the health side, you've got supplemental products, so cancer, critical illness, hospital indemnity, home health care, standalone dental and vision are all examples there. On the Medicare side, Medicare supplements, Medicare Advantage plans, and on the under 65, major medical insurance. We're very narrow and focused within these markets. There's the saying, jack of all trades, master of none. We want to be as good as we can be in these markets so that you can be as good as you can be in these markets. So let's talk a little bit about the opportunity.
If you want to market to the fastest growing segment of the population, yes.
So when we talk about the opportunity, everyone has heard us talk about 10,000 people turning 65 every single day. That number is now well over 11,000 people turning 65 every single day. We've been talking about the baby boomers aging in since I got into this business, 18 years ago. The baby boomers are absolutely aging in. We're getting ready to see the peak of that, but also we talk, and this is actually a phrase coined by Joel Lourie himself. He has a whole series of Joel Lourie-isms. The Southeastern Silver Tsunami, say that 5 times as fast as you can. And by the way, that actually is a picture of Joel at Folly Beach at the washout, getting ready to hit a wave. And I say that jokingly because if you know anything about Joel, he's afraid of sharks. But let's talk a little bit about the Southeastern Silver Tsunami. And so here I've got census data from 2000 to 2030 showing the population. And so what you can see is the total population in blue. And then what you see in the green here is also the 65, total population in this teal green color. And then the 65 plus population is in the blue here. So our total population from 2000 to 2010 grew 16%. But when you look at the 65 plus population, it grew almost 24%. From 2010 to 2020, total population grew 10%, where, look at this, the Medicare, the 65 plus population grew almost 40%. So 4 times the amount of the total population. Now projected between 2020 and 2030, that the overall population growth will continue to grow around 10%. But you still see the Medicare, the 65 plus population, almost triple that at 30% growth. Just to also further add to this, some data recently showing net migration. And so the top 10 states where people are moving to. Number 1, probably no surprise to anyone, Florida. Number 3, you've got North Carolina. Number 4, you've got South Carolina. Tennessee's right in there. And although Georgia's not on this list, this whole entire region of the country is absolutely exploding. These are people of all ages. These are Medicare eligibles. These are people under the age of 65. And, we're talking about areas like Myrtle Beach. We're talking about areas like Charlotte. We're talking about, Atlanta, right? But not just even those areas. Go to Camden, South Carolina. Go to Lancaster, South Carolina. And you're just seeing an absolute housing boom. All you need to do is on the interstates, and you can see how much more traffic we have now versus 5 years, 10 years ago. And so it's a great time to be in this business. And keep in mind, too, when people move, that also creates a special enrollment opportunity for them to find a new plan in their new area. So we're seeing the total population boom, that includes the Medicare eligibles under 65. And what I can also tell you, although there's not a slide on here to represent this, there are fewer and fewer of independent agents, people out in the community, engaging with these folks, helping them with their insurance solutions. So there's a tremendous opportunity in these markets. So how can we help you help more people? It starts with training. We know you're all also going to have different training needs, and this is really what sets us apart. Our extensive training is both in person and online, and it includes product training. So obviously we're going to get you up to speed on the products, how to set appointments, how to give a compliant presentation, how to do a virtual sale. We've got our Medicare boot camp webinars. We've got webinars and training on marketing, field training, client retention, and more. Today's webinar is a great example, and we'll have a whole series of webinars coming up here throughout the course of the year. Topics will include Medicare 101, Health Insurance 101, marketing throughout the year. We'll do deep dives into Medicare and health insurance, talk about Medicare supplements and the difference between supplements and advantage plans, how to work leads, how to give a compliant presentation. All of our events, all of our upcoming webinars, you can find on our agent portal at LourieAgents.com. That's LOURIE agents.com. Marketing, this is where I said that, there is no silver bullet. There is no one size fits all approach. We believe that every single one of you have different needs, and we want to sit down and have a conversation to put an individualized marketing in place. We'll help you to develop and implement a robust campaign to include many of the following tactics. Direct mail. Although direct mail leads have really tanked over the years, there are some specific areas it still is very effective for T65. Traditional print media, digital marketing. The next one is a big one, grassroots and community-based marketing. What we find when we look at the characteristics of our top producers, these are agents who are in their communities, that everyone knows who they are and what they do. They're engaged, they're attending community events, they're marketing with other business to business marketing. And so those are the agents, and that's an area of training that we also work with our agents on, how to become the masters, the go-to resources in their communities. Leveraging your existing book of business. So you're coming into the individual Medicare and health markets, you're a group agent. Let us show you how to market to your T65s. how you can stay in touch with your clients. You're an agent coming over and you're a traditional final expense agent, just getting into the health side of things. Let us help you with a campaign and show you how you can compliantly reach out to your life insurance prospects. And then next, building a network of referrals. This business, just like any other business, it is absolutely a relationship business. So AMP is our advanced marketing program. So for our all-in agent partners, those agents that have, at least, 3 or more contracts with us, agents that have shown a commitment to want to build and grow, we will give you access to our AMP program. It is a true turnkey program that helps agents with customized marketing materials, including traditional print materials, everything from business cards, letterhead, rack cards, flyers, newsletters. If you need help, with creating a logo, we've got some pre-approved digital media, social media posts, etc. The way all of these work is we just pop your information in, your headshot, your logo, your contact information, etc. And there's a whole host of other information that we have available to you. And I'll show you here in a bit where you can find more information about our AMP resources. And then support. In addition to providing industry best training and state-of-the-art marketing, we really pride ourselves on our around-the-clock support. Our support team here has well over 40 years of combined experience in these spaces, working with both clients and agents. Our team knows that when you call, they're always going to try and find a member of, one of our broker development team to see if they're available. If no one is available, our team is trained to come back and say, are you in an appointment? If you are in an appointment, they're going to stop. They're going to come find one of us. We're going to stop what we're doing in order to take that call, because we know that that's the most important phone call that we can take from you. So that's an example of the level of support that you can expect to receive here. That support also includes access to industry-leading software to both quote and enroll. We'll talk more about that. But in addition, we complement our support with further resources. 2 examples are Latest for Lourie. So this is a weekly email that's sent out to all of our agent partners. It summarizes anything that you need to know about what's happening in our industry, latest news, etc., upcoming changes, regulatory changes, etc. And then we also will do a review of upcoming events. And so any in-person trainings we've got coming up, any webinars that we've got coming up, it's something that you want to make sure. I know we all get wrapped up, in our day. I know we all get a ton of email. If there's only one email that you read, is read the Latest for Lourie, because there is a lot of information out there. We try and encapsulate all that for you in one place. And then Producers Call. This is a bi-weekly interactive call. It's every other Wednesday to keep you, our agent partners, up to date and to provide an avenue to ask questions and to hear from other top producers. We've heard from, this is something we started last year, that our agent partners have said that this has been a very valuable tool from them. Again, just to hear from us about what's going on. It's all going to be specific based on what's going on during that particular time of the year. But, again, it's an opportunity for you to perhaps ask a question. A lot of times you'll get to hear from top producers about, what's working for them. Sometimes we just like to share stories, right? It's tough for our agents that are out there. You're spending a lot of time out in the community, away from your homes, away from your families. A lot of folks, it's just them, right? And so to be able to get on a call, to hear from others, the trials and tribulations from other agent partners of what we're all going through on a daily basis. So it can also be quite refreshing as well. I mentioned our quoting tools. We've got a couple of different tools that we offer. One of them is we offer free access to CSG Actuarial. CSG Actuary is the industry's leading software to provide accurate, up-to-date quotes for Medicare supplement plans, Medicare Advantage, final expense life, hospital indemnity, and dental. It does have a paperless electronic scope feature, and you can also upload your logo and contact information for customized PDF quotes. Now, this is really from a technology standpoint where we shine, and it's called Lourie. So Lourie is an all-in-one enrollment and CRM portal. One area is where it's very much different than our competitors is that you have a single simplified all-in-one enrollment tool with a single sign-on for both Medicare and ACA. A lot of our competitors, you have one website where you go for Medicare, you have a completely separate site where you go for ACA. Here, it's all combined in one. You can look up and compare your clients' options based on the network, their doctors, based on their specific prescription drugs. It allows you to efficiently write business, whether in person or over the phone. It's going to help you eliminate clutters, avoid errors and pending applications. But I mentioned the CRM portion as well. So it allows you to manage your data, right? You can sort and report out of it as well. We tell agents, for example, this is a great time of the year to go back, look at all the folks that you were able to help out last year, make sure that you're reconciling them with your commission statements. And so there's some enrollment reports that you can pull out. You can then go back to the carrier portals to reconcile, make sure all your clients are active, make sure that you're getting paid. And those are just some small examples of the reporting features that are available in Lourie. But also within Lourie, it helps you market to your book of business so you can track birthdays. We're very big on birthday cards, right? Every client of yours should be getting a birthday card, being able to track your T65s, etc. And it helps you create a paperless file for your client. Now, I know I mentioned CSG has a scope feature. Lourie has an enhanced scope feature that they added last year that is extremely easy to use. So scope of appointment for Medicare, as well as the consent to contact for ACA, are all within the Lourie portal. And once it's completed, it's kept within that client's profile. So you're also meeting the 10-year retention requirements as well. And I mentioned how it could help you compare your clients' options. So it is an incredible resource. It gets better and better by the day. There are also some exciting changes that we'll be announcing soon, some enhancements coming to the Lourie enrollment portal. But this is a tool, this is technology that no one else has, that we offer to our agent partners at no cost. Let's talk about our agent partner hub. When we talk about our training, our marketing and support, this is where it is all housed. And so first off, we have a resource library. This is something that we are regularly maintaining and updating. I promise you 99% of the questions that you could ask, you'll be able to find the answer in the resource library. There are sections for materials, so ACA, contracting, ancillary products, life insurance, marketing, Medicaid, Medicare, and then our technology, there are sections there. And so you can go in and put in a keyword. You can see the search by keyword here. So it works a lot like Google does, and just say, type in election periods. And it's going to show you all of the resources that are available. So whether it's PDFs, whether it's a webinar that one of us conducted, whether it's a short YouTube video, it will show you all of the resources that are available there based on that keyword, or you can just search by category as well. So that's an incredible resource there to help support you. Our marketing request center, I'd mentioned the advanced marketing program and the customized pre-approved marketing materials. This is where you'll find those materials, is in the agent partner hub. And so here you'll go in here, you'll search for the different pieces, you'll then request it, and then that will then go to our marketing team, who will then help you customize it. Again, they're going to swap out and put your logo, if you've got one, your name, your contact information, all right into these pieces, which can then be sent to printing and set up to order. Here are some examples. So rack cards, we've got 3 different rack cards. So we've got one that combines over and under 65. We've got one that's just for the under 65 market, one that is for just the over 65 market. And you can see here, it's going to have, when it comes to Medicare, there's some very specific compliance requirements. It's got all of the pre-approved disclaimers and things that you need to remain compliant. Some other examples here are some flyers that we offer. So workshops, bingo events, etc. Event marketing. There are different flyers in there that you can customize as well. And then under the events and webinars, you'll see this is where all of our upcoming events are, where you'll find more information about the various events, whether it's in person, whether it's online via a webinar. You'll find descriptions and then links to be able to register. All of our webinars are recorded, including today's webinar, and they're archived. And this is also where you'll find all of our recorded archived webinars here under the events and webinars tab on the Agent Partner Hub. So what are the next steps? Give us a call. We stand by ready to assist. We're going to want to talk about your market and talk about what carriers you need, to make sure that you are able to help all of your clients in your market. Then from there, complete training and certifications. Once you've completed your certifications, you're ready to sell status. Your appointments can take anywhere from 2 to 3 weeks. We then want to sit down and have that conversation to put that individualized marketing plan in place, and then you can expect to receive the ongoing training and support that all of our agent partners receive here at Lourie Life Health. I got a final quote here from Joel Lourie. He says, when you love what you do and you can make a living from helping others, it's not work, it's a blessing. We are in the best business in the world because we get paid to help people with one of the most important decisions in their lives. So at this point, this is an opportunity for you to get any questions that you may have answered. So I'm going to go ahead and see what questions we've got coming in. All right, so I've got Tom in Spartanburg. Tom just said he's actually new in this business, and not a question. He just said he's excited and looks forward to partnering with us. Tom, thank you. Thank you for joining, first off, and I'm glad you like what you heard here today. So I'm going to go ahead and give you our phone number here. But Tom, if you'll give us a call, you've got the phone number there at the bottom of the screen. Stephanie in Charleston wants to learn more about the AMP program. And so Stephanie, again, if you'll just give us a call and speak with your member of the broker support team, what we can do is making sure you're able to log in. Everyone is given credentials once they partner with us, making sure you can log in, and then she can show you where you can go find the various resources. But let's just have a conversation as well about which of the resources, make sense to you. Let's see. This is Tracy in Savannah. Tracy was just wanted to know what carriers do we work with. So Tracy, I know we didn't talk about it here today. Our specialty, we talked about our lines of business is the individual health, Medicare, and life markets. But we are an independent insurance brokerage. We work with all of the major and regional carriers that are here in your market. So from Blue Cross Blue Shield, Aetna, United Healthcare, Humana, etc. And then Barnhill is asking, will this webinar be available for replay? I missed it. So Barnhill, I'm sorry that you joined us late, but yes, the answer to that question, all of our webinars are recorded and are available on demand on our broker hub. You can see the URL at the bottom of the screen. So at LourieAgents.com, that's LOURIE agents.com. Cheryl's just saying thank you. Cheryl, thank you. We appreciate you. And with that said, I've got a question for each of you. Who do you want to partner with? Well, I sure hope it's us here at Lourie Life and Health. So any further questions or you would like to get started with a partnership today, give us a call, 888-553-3323. My name is Chris Johnson. Make it a great day. Goodbye.